Hello, my name is Thao Batovsky and I'm a student pharmacist at Sullivan University. He is a 27 years old African American female patient and she came in with a chief complaint of increased asthma symptom. So she does complain she with her chief complaint, she doesn't appear to be in acute distress. She stated that her daytime symptom approximately about 3 times per week, and she have to use her rescue inhaler about 3 to 4 times a week, and she got woken up during nighttime because of her symptom about about approximately 1 time a week. The symptom does not seem to tie to any exertion alone, and she stated that she good compliance with asthma medication and she demonstrate good technique as well. So past medical history, she have mild persistent asthma for about 1 month and she is currently on maintenance and rescue inhaler. Her medication for her asthma is hmm, fluticasone proporion 0.04 milligram per actual meter dose, and she doing 2 puff by mouth twice daily. And then she also on a rescue inhaler of albuterol 0.04 milligram per actual meter dose inhaler, and she also does that 2 puff by mouth every 4 hours as needed. Other medical history, she have general motor seizure, and for that she is currently taking topiramate 100 milligram pill BID. Family history wise, there's really nothing pertinent to her condition. She could deny any recent alcohol, and she quit smoking 3 years ago. Her insurance, she have Anthem Blue Cross and Blue Shield Medicaid. She currently up to date with all of her vaccine, and she got her influenza vaccine back in January of this month. For her physical findings, she seemed lethargic with increased asthma symptom, with intermittent insomnia and mild wheezing. Blood pressure was 110/72 with a heart rate of 90. Her temperature was 36.8 and her respiratory was 18. She is a 5'9" and her weight is 71.8 kilogram. With that, her ideal body weight is 66.2 kilogram, and her BMI is 23.3. Her red blood cells seem elevated at 5.1. Her serum creatinine is good. It's over 0.8, and that put her creatinine clearance as 120 milliliter per minute. So for her, after assessing the patient, her problem is uncomplicated, mild persistent asthma, and it is not controlled. She is currently on step 2 of the GINA guideline with the low dose ICS and a PRN SABA as a rescue inhaler. Per her symptom, because she had 2 daytime symptom per week, she got 2 night waking and at least 2 reliever needed every week. I think it is appropriate to escalate her treatment up to the step 3 of the guideline, which is a daily low dose ICS plus a LABA. And then we can keep her PRN SABA as a reliever the same. So for that, the goal of the treatment is we're gonna relieve her asthma symptom, improve patient quality of life. So first off, my recommendation is that we're gonna keep her rescue inhaler the same, which is the albuterol 0.09 milligram per actual meter dose to inhale every 4 hours as needed. For her scheduled medication, we're gonna move her from a low dose ICS to a low dose ICS with LABA. And I check her insurance, and it is preferred treatment, so we can put her on Advair, and the dose is gonna be 45 microgram per 21 microgram. And we're gonna do 2 inhalations, BID by mouth. And so this medication, we need to watch out for headache, upper respiratory tract infection, pharyngitis, and because of the ICS, we need to watch out for like thrust in her mouth or any blood sugar problem. And we're gonna monitor the efficacy of this medication. We're gonna monitor for the improvement of the symptom within about 2 weeks of the initial dose. And then if she's continuing to complain with the issues, we're gonna escalate from there. So if you have any questions, please let me know. Thank you and have a good day.